Welcome to the another video of Basic Pathology Unit 1 and Unit 2, both covered syllabus. First video. Let's dive. Subject: Basic Pathology. Unit 1, Introduction to General Pathology. 1. Understanding of pathology. Definition: study of disease, its nature, causes, progress, and effects. Focus on structural and functional changes in cells, tissues, and organs. 2. Fields of pathology. Histopathology, study of tissue disease. Cytopathology, study of disease at cellular level. Hematology, study of blood and blood disorders. Chemical pathology, study of biochemical abnormalities in disease. Microbiology, study of disease-causing organisms. Immunopathology, study of immune system in disease. Forensic pathology, application in legal/medico-legal cases. 3. Importance of pathology. Essential in understanding disease mechanisms. Forms the basis for diagnosis, treatment, and prognosis. Bridges basic and clinical medical sciences. 4. Scope and method. Examination of tissues, fluids, and cells. Methods: microscopy, staining techniques, laboratory tests, biopsies, autopsies. 5. Application in laboratory investigation and diagnosis. Blood tests, e.g. CBC, ESR. Biopsies. Urine analysis. Microbial cultures. Histological and cytological analysis. Unit 2, Basics of cell injury. 1. Introduction to cell injury. Occurs when cells fail to maintain homeostasis due to harmful stimuli. Can be reversible or irreversible. 2. Types and causes of cell injury. Types: reversible, swelling, fatty change. Irreversible, necrosis, apoptosis. Causes: hypoxia/ischemia. Physical agents: trauma, radiation. Chemical agents: drugs, toxins. Infectious agents: bacteria, viruses. Immunologic reactions. Genetic abnormalities. Nutritional imbalances. 3. Common terminology in cell injury. Necrosis, cell death due to injury. Apoptosis, programmed cell death. Atrophy, shrinking of cells. Hypertrophy, increase in cell size. Hyperplasia, increase in cell number. Metaplasia, change in cell type. 4. Clinical diagnosis and laboratory interpretation. Biochemical markers, e.g., troponin in myocardial injury. Histological findings under microscope. Radiological tests to assess organ damage. Inflammatory markers, e.g., CRP, ESR. Correlation of lab results with patient symptoms. MCQs. 1. What is the main focus of pathology? A. Treatment of diseases. B. Prevention of diseases. C. Study of disease mechanisms. D. Surgery of affected organs. Answer: C. 2. The study of tissue samples to identify disease is known as A. Cytopathology. B. Histopathology. C. Hematology. D. Immunology. Answer: B. 3. Which field of pathology studies blood and its disorders? A. Histopathology. B. Cytopathology. C. Hematology. D. Chemical pathology. Answer: C. 4. Which branch of pathology deals with legal investigations? A. Immunopathology. B. Forensic pathology. C. Microbiology. D. Cytopathology. Answer: B. 5. Cytopathology focuses on the study of A. Organs. B. Tissues. C. Blood. D. Cells. Answer: D. 6. What is a common method used in pathology for diagnosis? A. Radiotherapy. B. Biopsy. C. Vaccination. D. Dialysis. Answer: B. 7. Which of the following is not a purpose of pathology? A. Understanding disease. B. Diagnosing disease. C. Preventing traffic accidents. D. Planning treatment. Answer: C. 8. Which branch studies the immune system in disease? A. Microbiology. B. Immunopathology. C. Chemical pathology. D. Hematology. Answer: B. 9. What type of test would be used to examine tissue under a microscope? A. MRI. B. Histopathology. C. ECG. D. Urinalysis. Answer: B. 10. Pathology helps in all except A. Disease detection. B. Disease prevention. C. Disease analysis. D. Disease treatment planning. Answer: B. 11. Cell injury occurs when A. Cells function normally. B. Cells adapt to stimuli. C. Cells fail to maintain homeostasis. D. Cells divide normally. Answer: C. 12. Which of the following is a reversible injury? A. Apoptosis. B. Necrosis. C. Cell swelling. D. Cell rupture. Answer: C. 13. Which of the following is a type of irreversible cell injury? A. Atrophy. B. Fatty change. C. Apoptosis. D. Cell swelling. Answer: C. 14. Which of the following is a cause of cell injury? A. Balanced diet. B. Oxygen supply. C. Physical trauma. D. Normal blood pressure. Answer: C. 15. Increase in the number of cells is termed as A. Atrophy. B. Hypertrophy. C. Hyperplasia. D. Necrosis. Answer: C. 16. Programmed cell death is known as A. Necrosis. B. Inflammation. C. Apoptosis. D. Lysis. Answer: C. 17. Necrosis is A. A normal body process. B. Always reversible. C. Pathological cell death. D. Cell adaptation. Answer: C. 18. A decrease in cell size is called A. Hyperplasia. B. Atrophy. C. Hypertrophy. D. Dysplasia. Answer: B. 19. Metaplasia is defined as A. Cell death due to infection. B. Change from one cell type to another. C. Decrease in cell number. D. Increase in cell volume. Answer: B. 20. Elevated troponin levels in blood indicate injury to the A. Liver. B. Brain. C. Heart. D. Kidney. Answer: C. Subscribe the channel for more videos. Thank you.